And what we also found out too, especially here in Arizona where I live, some of the payers actually had their EFTs, so their electronic funds transfers, were dictated through Change Healthcare. So there were some payers that actually couldn't even release payments on the claims that they had. So they had to start cutting paper checks in order to get these providers paid. Really what we did is a couple of different things. One, I would say, to their credit, a lot of the insurance companies did step up and make alternate pathways for claims to go through, whether it be Medicare. For a long time, unless you could get a waiver, would not accept paper claims. So they would say no paper claims, everything has to be electronic unless you can get this waiver. And I don't know of anybody who actually got the waiver approved. Unless you can get this waiver, you can't send paper claims. And so Medicare actually started allowing paper claims to come through for the first time in a very long time in order to get claims out. And then many of the other payers, you have the option where you can drop to paper, but it takes longer. But then also some of the other payers quickly spun up alternate pathways, whether it was through another clearinghouse, through direct submission, through online portal entry, through online uploads, really finding a bunch of different ways to kind of get around the Change Healthcare issue. What was happening is then we were having to go back or having to have conversations with various clearinghouses and various practice management systems saying, hey, can I get this file? Can I get this in order to send this through? And so, there was ways around it, but it wasn't easy. Going forward, I would say, understand your clearinghouse, understand the limitations, and understand some more about how some of these payers work and how they process, because what's happening is we couldn't get claims out, but then some of the payers couldn't even process them if they got them, and they had no way of finding that out. And then we also had the opposite problem where we could get them the claims, but then they had no way of telling us who was paid, which patients were paid, because all of the EOBs and ERAs were also sent out through Change Healthcare.
The fix isn't more automation, it's keeping patients engaged with a human in the loop. That's exactly what we built for. As a matter of fact, that human to human connection is so important to us here at SynsorMed that we created a new AI tool called Simon. It's about getting patients engaged in their own care while keeping the human in the loop. A reward-based system that gets them taking their meds, checking their blood pressure, and staying active, all in a point system with leaderboards to keep them excited about their healthcare journey. It really keeps the patient and the human in the middle, but uses AI to track everything and encourage patients along the way. Hey, if you want to see it, if it fits your organization, put the link below, check it out, and give us a call if it makes sense.